Okay. My name's Aaron. I'll be your nurse today. Can you tell me your name and date of birth?
Stephen Reynolds, 9/21/51.
You having any pain today?
No.
Okay, good. So we're going to do a peripheral vascular and cardiovascular and abdominal assessment on you today.
Okay.
So the first thing I need you to do is just spin around for me, okay? So the first thing we're looking for is even skin tone, hair patterns, any discolorations, any lesions, bumps, bruises. Palpating for any decrepitous, and there's no decrepitous noted. Patient is in a relaxed position, breathing evenly. Patient, if was in distress, would be in like a tripod position, but in this case, the patient is in a normal position, relaxed. I'm going to palpate over your scapula. Is there any pain? You having any pain?
No.
Okay. So we note that the scapula, shoulders, and rib cage recoil and expand symmetrically, naturally, and bilaterally. The next thing I'm going to do is tactile firmitis. So when I tell you, I want you to say 999, okay?
Okay.
Okay.
999. 999. 999.
Okay.
999.
And tactile firmitis is noted throughout and even. There's no dullness anywhere. Now we're going to check for chest expansion. I'm going to place my fingers at T9 and T10. And I want you to take a deep breath. And chest expands and recoils naturally and bilaterally. The next thing we're going to do is listen, okay? I'm going to listen to your lung sounds. We're going to listen 18 different places on the back. And there's no adventitious sounds noted. Patient does have a few moles, but other than that, skin tone is even and there's no breakdowns noted. Now, can you turn around for me? So the first thing we're going to do anteriorly is check the skin. We know the skin tone is even in color bilaterally. There's no lesions, bumps, bruises, breakdowns. And then we're going to palpate for crepitus, and there's no crepitus noted. Then we're going to go and palpate the apical pulse, which is mid-clavicular, fourth or fifth intercostal space. And most people you won't be able to feel. And his is unpalpable. Okay. Now I'm going to listen to your heart. So in the first place we're going to listen is the aortic, second intercostal space, right sternum border. And there is a normal S1, S2, no S3 or S4 noted, and there's no murmurs. And we're going to listen to the pulmonic. He has a normal S1, S2, no S3, S4, or murmurs noted. And hit the Erb's point. Also, normal S1, S2, no S3 or S4, or murmurs noted. And the tricuspid. And we have a normal S1, S2, no S3, S4, or murmurs noted. And finally, the mitral. And we have the normal S1, S2, no S3, S4, or murmurs noted. Okay. So now I'm going to check your pulses, okay?
Okay.
I'm going to check the temporal artery. And it is a +2, equal bounding and bilaterally. Now I want you to turn your head slightly for me that way, toward the window. And what we're looking for is JVD, or jugular vein distension. I want you to look toward the wall for me. And there is no jugular vein distension noted. We're also going to auscultate for bruise over the carotid artery. And there is no bruise noted. So I'm going to palpate your carotids one at a time. And they're +2, equal bounding and bilaterally. Right, so now I'm going to check your arms. And we're going to look for warmth, dryness. Patient's arms are warm, dry, skin is intact, there's no discolorations, no deviation in hair pattern. We're going to check your brachial artery, which is a +2, equal bounding and bilaterally. And now the radial is a +2, equal bounding and bilaterally. And the ulnar is a +2, equal bounding and bilaterally. And we're also going to check for capillary refill, which is less than 2 seconds, and skin tuger, which is less than 3 seconds. And we're noting too that patient is not in any labored position when it comes to breathing. Patient is in a relaxed position. Then we're going to listen for your breath sounds, okay?
Okay.
We're going to listen in 8 different places on the front.
Okay.
So now we're going to go on down the leg. So we're also looking at the legs. We're also checking for warmth, dryness, making sure there's no deviation in hair pattern or alteration in skin color. Patient does have an even skin tone.
Let's get them over here.
Equal and bilateral. We're checking for warmth, dryness, the skin is intact, there's no deviation in hair pattern. We're going to check the popliteal pulse, which is a +2, even and bounding bilaterally. We would check for the femoral pulse right here, but for all intents and purposes, we're not going to do that to this patient. We're also noting any edema, and there is no edema noted. We're going to check the posterior tibial pulse, which is a +2, equal bounding and bilaterally. And the dorsalis pedis, and it's a +2, equal bounding and bilaterally. Oh. We're also going to check for any blood clots. Usually we do a Holman sign, which is you push against my hands. Any pain?
No.
Pull against my hands. Any pain?
No.
However, that's not the preferred method, so we're going to do the preferred method, which is measurement of the calf. And we're at 14 and a half. And 14 and a half. And the reason we don't use the Holman sign is because we could break loose a clot. Alright, you can let your feet down. And we would also check for pulse deficit, which we would get the apical pulse, which we'll check right now. And patient's apical pulse is 64. We would also get a radial pulse, and we would take the difference, and that would be the pulse deficit. Okay, if you could lay down, we'll do your abdominal assessment now.
Okay.
Readjust. Okay. So the first thing we want to note is the patient has an even skin tone, even color, bilaterally. We don't know any bruises, lesions, any vibrations that shouldn't be there. We don't know any use of accessory muscles to breathe. And now we're going to listen to the patient's bowel sounds, and we're going to start listening in the right lower quadrant. We're also going to note the patient has a rounded abdomen. We're also going to listen over the liver and spleen for any friction rubs. And there is normal active bowel sounds in all four quadrants, and there is no friction rub noted over the liver or the spleen. Next, we are going to listen to the aorta in the epigastric area. And we're listening for any bruits. And there's no bruits noted. We're also going to listen in the umbilical area and the suprapubic area. Patient's umbilicus is inverted. I'm going to percuss. No dullness noted over the liver or spleen. And tepny is noted throughout. Now we're going to check for rebound tenderness. So I'm going to push in and release it, and you tell me if you have any pain.
Nope.
Any pain? Okay. All right, now I need you to sit up for me.
Yeah, thanks.
And you can also check for gallstones by doing what we call a cautil vertebral angle by Tap it on the patient's back. Any pain?
Nope.
And if patient was having, oh, you can't see me. And if patient was having any gallbladder issues, we could tap on the bottom of the foot like so. Any pain?
Nope.
And patient wouldn't have terrible pain if he had gallbladder issues or gallstones. And I think that's it.
Okay.